And we are going to start very aggressively in the administration cracking down on the people and the organizations that are defrauding Americans. So we're announcing today that we have decided to temporarily halt certain amounts of Medicaid funding that are going to the state of Minnesota in order to ensure that the state of Minnesota takes its obligations seriously to be good stewards of the American people's tax money. Now, what is this going to mean? What this means is that, first of all, the providers on the ground in Minnesota have actually already been paid. The state has paid those providers the money. What we're doing is we are stopping the federal payments that will go to the state government until the state government takes its obligations seriously to stop the fraud that's being perpetrated against the American taxpayer. There are a few different ways that we're doing that. There are a few different affirmative actions that we're taking today. Dr. Oz is going to talk about those, but let me talk a little bit about the spirit of this and why we're doing it. So number one of the examples of fraud that we've seen in Minnesota that we verified that is just awful is that a program that existed to ensure that autistic children had access to some after-school services has made a number of people rich, not by providing services to needy children, but by allowing fraudsters to take money that ought by right go to American citizens and to American families and to set up sham businesses, set up sham clients, set up people who are not even autistic but claim to be autistic in order that they benefit from the money that's out there. Now, what does that mean? Number one, it means that a lot of people are getting rich off the generosity of American taxpayers, but more fundamentally and more importantly than that, it means that there are kids in Minnesota who deserve these services, who need these services, and they're not going to those kids, they're going to fraudsters in Minneapolis. That is unacceptable, and that's the sort of thing that we're cutting off with this action today. Let me make one final point about the spirit of this. You know, one of the things I love about our country is that we're a generous country, we're a generous people. We take care of our fellow citizens who can't afford medical care because they're down on their luck. We take care of people who can't afford to put food on the table even though they work hard and play by the rules. We recognize that we're all in this together, and part of the reason why we have Medicaid, or part of the reason why we have food stamps, part of the reason why we have these programs is we want to make sure that kids who grow up in families not all that different from the family that I grew up in, that they have access to the basic necessities: food, medical care, after-school services when their family needs them but they're unable to pay. What's happening in Minneapolis, in California, in a number of states all across our country is that the generosity and the good hearts of our fellow Americans are being taken advantage of. We're taking that social contract that says that our American citizens, we take care of one another, and we're allowing a few bad actors to get rich off that generosity of spirit instead of providing the services to the kids who need it. This is disgraceful. It has happened for too long. Far too many people have gotten rich by taking what is the best of the American spirit and getting rich off of it instead of providing services to kids who need it. That is stopping today. We're taking a whole-of-government approach in the Trump administration to take this fraud seriously. What Mehmet Oz and his team at CMS have done is really remarkable, and it's just the first step of our efforts. So without further ado, let me turn it over to Mehmet to say a few words about what he's doing, what his team has uncovered, and what they're accomplishing with this new action. Dr. Oz.
Mr. Vice President, I appreciate the leadership on this. There's no question that his commitment, the Vice President's commitment to rooting out this fraud is going to make a massive difference in preserving and protecting our nation's public health programs. It's going to protect patients. I want to thank President Trump for pushing all of us to make sure we protect our most vulnerable Americans, the ones that J.D. mentioned, the ones he grew up with, the ones all of us know in our lives. It also protects taxpayers from attacks on our healthcare system. Secretary Kennedy has spearheaded these efforts, and thanks to his leadership, I'm proud to announce the largest fraud initiative, anti-fraud effort of its kind in CMS history. Now, why is this action necessary? Last night in the State of the Union address, the President spoke about the affordability issues that we have improved dramatically in this administration. But let's put some numbers on health care. The average family puts about $27,000 in the health care a year. They only pay $7,000 themselves, which is a lot, but there's an extra $20,000 invested for them. This is not a reasonable amount of money to spend. We have got to bend that curve downwards. It's unpredictable as well when you have to make these expenses, and the fraud that we're experiencing in America is making this already dangerous problem much worse. So we're going to fix these issues. The president last night spoke about the need for price transparency. That's going to help by making people more aware of what they're paying. It's also going to help us at CMS figure out what you should be paying and identifying fraud. To that note, the president announced last night that he's appointing our vice president to lead the war on healthcare fraud, a wise choice. Your passion for this will make a huge difference. This is not about the money by itself. This is about people's lives and our culture, our shared values that have allowed these beautiful programs, Medicare and Medicaid, to survive brilliantly for 60 years. We believe, listen carefully, we are spending $300 billion a year in healthcare in this country for fraudulent, abusive, or wasteful purposes. $300 billion. Let's put that in perspective. If we could reduce fraud by 5%, which is at $300 billion, we would take the trust fund that's going to take care of all of us as we get older, and we would allow it not to expire in 5 to 6 years. We would double its life expectancy. That's massively important if you're going to trust the social safety net to be there for you. You deserve that social safety net. It's there. It's created. We're not going to let fraudsters steal it from you. The stellar CMS team, I want to call them out. Kim Brandt, who's videoing me over there, Dan Brillman, Capri Snap, Steph Carlton, have worked tirelessly to put this together. They've been rooting out criminals all year long. I know as well what it's like. I visited all these areas, personally witnessed what it's like to see something you know is wrong and wonder why no one tried to fix it. It's infuriating. The vice president described very accurately exactly what you see on the ground. These self-serving scoundrels, that's what they are, who rob our federal and state health programs, have decided it is worth the risk. I'm going to make a proposition to you. If you commit crime on Medicare or Medicaid in America and you steal, let's say, a couple $1 million, your jail sentence, first-time offender, maybe a year. For a lot of folks, that's a good deal. We have to take these crimes seriously and treat them as seriously as if they were bank robberies, because they're more dangerous than bank robberies. People get hurt during them. Let me share some of these horrible stories. The vice president started highlighting autism. Let's get into the details of what's really going on in Minnesota. These are real cases from our group at CMS. These are adjudicated numbers. There's a fraud scheme in Minnesota where criminals, soon to be criminals, pay moms $1,000 roughly in order to enroll their children as being autistic, falsely, dishonestly claiming their children are autistic. They then bill Medicaid, this has already happened, millions of dollars for services that were never rendered, never delivered by a qualified staff member. These schemes disproportionately involve immigrant communities. They're insulated, they're able to organize efforts, and sometimes they don't understand what's going on. And it ultimately diverts resources away from kids who truly have autism. Because if every kid in the neighborhood has autism, then nobody has autism in terms of how you can manage them. There was one behavioral, and by the way, these kids, they carry that diagnosis of autism the rest of their lives. Their mom made a bad decision, the kid pays the price for the rest of their life. There's one behavioral health organization, Mr. Vice President, in Minnesota. They received $11.5 million in Medicaid payments, but the top biller submitted 450 days where they claimed they were working more than 24 hours a day. I mean, even in the White House, that's tough. It's hard to work more than 24 hours a day. How it didn't get picked up is shocking to us at CMS. There are other red flags in Minnesota, including hundreds of beneficiaries receiving treatment linked to one location, which was impossible physically to be true. We had 8 beneficiaries in one of these substance use disorder centers, 8 who were already dead, but the center was still billing us.